Preventicus is a health tech startup that developed the technology to detect atrial fibrillation and to support stroke prevention, from screening to treatment decisions. Their programs are validated from a health economic perspective and can help to save lives. That's why we at Generali Group are happy to work with Preventicus. Next on stage, Preventicus.
While I am on stage, 9 people in Europe will suffer a cerebral stroke, the leading cause of disability and healthcare costs. Preventicus has a simple purpose: getting down strokes, getting down costs. Good evening, ladies and gentlemen. I'm Thomas Hübner, founder and CEO of Preventicus, Christoph Eisert, head of sales. The stroke rate increases year by year. The treatment gets better and the death rate goes down. But the costs are going to explode. We speak about 50 billion euro annually stroke costs in Europe. There's a major reason and responsible for up to a third of strokes: undetected cardiac-driven disease called atrial fibrillation. Identified atrial fibrillation can be treated effectively, e.g. by drugs, which reduces stroke rate by 70%. We have 7 minutes left to see how we in reality decrease Europe's stroke rate and costs together. 20% of Europe's population are at risk of atrial fibrillation and, if not treated, subsequent stroke. AF is a shy animal. It comes and it goes, often sporadic, often without any symptoms, makes it very hard to capture. In 8 of 10 people with atrial fibrillation, the standard care with 24-hour Holter ECG fails to detect it. Preventicus has developed a groundbreaking method to detect and document atrial fibrillation simply by a smartphone camera, as you will see in some minutes. We simply turn a smartphone into a certified medical device, which has been proven in several international clinical studies. It has world's leading accuracy. This technology is already recommended by the European Society of Cardiology in their AF screening guidelines. Population screening of atrial fibrillation is the first and most important step, but it's not enough for final AF confirmation and a lifelong treatment decision. That's why Preventicus acts as a full service provider, from screening to AF confirmation to treatment decision and reimbursement. It has a unique scalability and diagnostic yield. The cost of AF screening and confirmation is 10% of any next competitor. We have a proven health economic benefit. The cost for detection and treatment of AF with our method is less than the cost of avoidable strokes. How it works will Christoph show in a minute.
Thank you, Thomas. So Preventicus structured screening starts with identifying those people that have an increased risk of stroke. These people will benefit the most. Risk factors for stroke include hypertension, diabetes, obesity, age above 55. So that's a large group of your clients. And you, as insurance companies, you can invite your clients to participate in atrial fibrillation screening. Thomas here, our model client, has just received a letter from his health insurance company inviting him to participate in AF screening. For AF screening, we need a medical-grade heart rhythm analysis. And all that is needed for Thomas or any of your clients to participate in AF screening is a standard smartphone with a camera and LED flash. We don't need any cables or any accessories. And Preventicus Heartbeats works with both Android or iOS phones. So what you've been seeing now was our application able to capture the heart rhythm. You saw pulsating waves, and that was each wave for a heartbeat. When the heart is pumping, blood is pumped through the body, and this creates pulsating blood waves, and they can be recorded at a fingertip. All you need to do is place your smartphone camera on your fingertip. And the measurement then completes within 1 minute, and every heartbeat is analyzed. Immediately then on the phone, you see the heart rhythm analysis report. And if it's a regular rhythm without any findings, Thomas or any of your clients will be reminded to keep measuring regularly. If there are signs of atrial fibrillation or other heart rhythm disorders, the data will be sent from the phone to a telemedical center, directly from the app. In the telemedical center, a medical technician reviews the data to make sure that no client is sent to physician care based on a noisy recording, and to validate signs of atrial fibrillation and arrhythmic events. When AF is validated, Thomas will receive, and any of your clients will receive automatically an appointment with a cardiologist near where they live that is part of our AF Solutions network. So when Thomas goes to his doctor's office, he will receive a special ECG diagnosis with an intelligent ECG recorder that is capable of recording up to 14 days of continuous ECG. And according to guidelines, we need a chest wall ECG for any therapy decision for atrial fibrillation or heart arrhythmia. And the Preventicus 14-day ECG service is 3 times more effective than the standard 24-hour ECG. And as Thomas is wearing it, it will be constantly recorded, and any arrhythmic event will immediately be transmitted via his phone to the telecare service, and the telecare service will provide a summary report to Thomas's physician. So when Thomas goes to see his physician again, his doctor again after 14 days, the doctor will already have all relevant data available, relevant for diagnosis and therapy decision. And he can discuss therapy options and diagnosis with Thomas or any of your clients. And when AF is confirmed by ECG, therapy can be initiated, appropriate therapy, to reduce stroke risk by 70% or even more for Thomas or any of your clients.
So stroke, as I have mentioned, is the leading cost driver and of increasing health and social impact. Undetected atrial fibrillation is the main driver for stroke, being sporadic and very hard to capture by standard care. Any device-based population screening failed so far because it was not scalable and not cost-effective. Our core technology converts a standard smartphone into a medical device that captures very precisely and accurately atrial fibrillation just with a smartphone camera, followed by subsequent services for AF confirmation at specialized cardiologists. For the first time, we have been able to prove a positive benefit to cost ratio. That means the costs for identification of atrial fibrillation and treatment are lower compared to the costs of avoidable strokes. We have first mover, we have first paying health insurances. We are working, for example, very closely together with the Generali Group. We embedded our technology into the existing ecosystem of a health insurer Central. So now we are ready for scaling up our technology in Europe. Let's reduce Europe's stroke burden and costs together. Thank you so much.
Thank you.